So here's the thing about mast cells and what they do to the body, right? Because mast cells are these immune cells that they're most well known for histamine, but they also create other inflammatory mediators like prostaglandins, leukotrienes, and all of that stuff. And prostaglandins are one of the things that can cause more pain responses. If you look at some of the analgesics that we have on the market, like NSAIDs, they're ones that inhibit like COX-1 and COX-2 pathways to inhibit these things called prostaglandins cause pain, and pain medications inhibit prostaglandins to remove pain. So mast cells being a type of cell line that can produce prostaglandins makes it so that a lot of pain can become worse. So yes, to answer this question in a very long way, arthritis is common in mast cell activation syndrome, and so is like a lot of body pain because of it. Although arthritis itself is kind of a non-specific symptom, so in order to attain a diagnosis of MCAS, you still do have to have a lot of the symptoms that are more histamine related and are a little bit more episodic and more associated with like that type of allergic system picture. This commenter also asked about fevers, and fevers are kind of in that same vein where, yes, kind of, because the mediators that mast cells create also can influence body temperature regulation and inflammation that does trigger like fever responses. Sometimes mast cell activation syndrome patients will experience these as like flushing, hot flashes, or just general temperature dysregulation, low-grade fevers that are relapsing and remitting. So yes, fevers can be a picture there, but again, it's kind of non-specific. For diagnosis of MCAS, we're really looking at the constellation of symptoms that come together because it is a syndrome. It's not one particular symptom. There's not a lot of symptoms that are pathognomonic for MCAS unless you do have systemic mastocytosis, which is a primary type of MCAS, in which case there's something called urticaria pigmentosa that happens in primary MCAS, where if you're a clinician who's seen it before, then you're like, oh, we want to look into this. But otherwise, with other types of MCAS, it's really hard to see like if there's that one symptom that is like, oh yeah, this is MCAS. It's more that we're looking for this constellation of your experience of, okay, now we have a suspicion. We've ruled out some of the other stuff. Let's go into some testing and let's see if your constellation of weird symptoms can be explained by this one diagnosis. I hope that helps. Thanks.